Washington state just got 8,000 more COVID-19 test kits that are desperately needed right now. KOMO's Tammy Mutas is live in the newsroom, so we know not everyone who wants to be tested will be. So who's going to benefit from these extra test kits, Tammy?
Well, Mary, first of all, health officials say the kits will be distributed to areas that are hit hardest by COVID-19 in our state. That's King, Pierce, and Snohomish counties. State health officials say these extra 8,000 test kits are intended to ramp up testing capacity for high-risk populations. That includes elderly people, people with pre-existing conditions, plus the healthcare providers and first responders who are caring for others during this crisis. The state health department says the governor, Secretary of Health, and the U.S. Department of Health and Human Services came together to respond to the request for more COVID-19 testing. Officials say they also received protective equipment supplies needed to do those tests. This morning, President Donald Trump vowed to make testing and supplies available to states around the country.
Nobody knew there'd be a pandemic or an epidemic of this proportion. Nobody's ever seen anything like this before. I can tell you that what we're doing is we're working with local governments, with states, governors, even mayors, on getting them to be able to get what they need.
State health officials say they've been ramping up testing after the state lab got more testing equipment. They can test more than 200 samples per day. Officials say the goal has been to test 400 samples per day. And state health officials say they hope to get even more test kits from FEMA and the U.S. Department of Health and Human Services when those become available. Back to you.
Well, Seattle Children's Hospital told me that they collected tens of thousands of specific face masks this past week. All across Puget Sound, people have been stepping up and donating personal protective equipment. On social media, we see all sorts of references to Give Me PPP, Give Me Personal Protection Equipment. And in the Puget Sound area, businesses and individuals are answering that call for help. In Everett, dentist Dr. Bob Hughes took a look at his inventory and says he's stepping up and doing the right thing.
Because we're running a skeleton crew and are downsized at the moment, we're not going to be using all the supplies we have. And of course, we're hoping that the supplies will be in order when we get back to work, whether that's in a week, a month, 2 months. We're hoping that the supplies will be here.
We checked in with several hospitals to see how much they truly need and how much of a shortage they're facing. Harborview, Swedish, Seattle Children's, they all say they're facing a shortage of supplies. In a statement, Kaiser Permanente says it's moving to virtual care. Quote, moving to virtual care is a strong stand to help us slow the spread of the virus and preserve the personal protective equipment resources needed to care for our community and protect the safety of the staff. And here at Seattle Children's, between 9 a.m. and 3 p.m. every day, they're accepting very specific types of N95 masks, basic isolation masks, and surgical masks. They must be in unopened bags or boxes. People who donate are screened, and the donated medical supplies are also carefully reviewed.
The Tyvek suit is zipped up as 2 pairs of gloves and a mask are put on.
It gets warm after a while.
Terry Sinclair shows us how a new drive-through clinic is being used to test first responders for COVID-19.
The tester will go back, complete the test.
Those who believe they've been exposed and are showing symptoms pull up in their car and have their nose swabbed.
He'll place the Q-tip swab in there.
That sample is then sent off to the UW Virology Lab for testing. The goal of this site is to help hospitals focus on testing others and get first responders back on the streets as soon as possible.
We have a service that we have to provide to the community. We don't have, unfortunately, the luxury of just shutting down operations and waiting for this to go away.
56 people from Seattle's police and fire departments and several other agencies outside the city have been tested since this clinic opened on Saturday. So far, only 2 have come back positive. Seattle's police chief says the idea is the first of its kind in the country.
I can tell you my email is full from chiefs all over the country trying to figure out how to emulate this process.
The patient often coughs or sneezes during the test, so protective gear and distance help reduce the chances of spread.
This is the only area that is identified as a potential exposure area, right?
Any gear that may be contaminated is thrown into biohazard bins nearby. The city's fire chief says 45 firefighters have been taken out of circulation in recent weeks due to potential exposure to COVID-19 while they're out in the field. 24 are still out. So generally, it takes about 48 to 72 hours for results from this drive-through site to get back from UW's virology lab. More than 100 test kits are available here right now. Another order is on the way, we're told, and right now that's enough to get through at least the next week. Beyond that is really up in the air at this point. Live in South Seattle, Steve McCarran, KOMO News.
It's starting to happen.
Alvera Salinas is free to go.
People accused of nonviolent offenses are out on their own rather than going to jail.
Mr. Neighbors is free to go.
This is room 1201, a very busy and crowded courtroom where attorneys have complained people are just too close.
If you feel like you're too close to people sitting right there, you can hear my voice from that hallway.
But things are changing. A video system.
It'll also allow out-of-custody people to download an app and appear virtually in court.
Changes have to be made because the state Supreme Court justice just ordered that all criminal trials where someone is out of custody are on hold for a month.
Really, the order suspended almost every trial except for criminal bench trials.
Meaning it's heard by a judge with no jury. But people will still be arrested, taken to jail, beginning a long backlog of cases. So prosecutors, defense attorneys, and judges are looking at defendants who fit the CDC's criteria of a vulnerable population and make their cases a priority and make their release a priority to free up jail space.
So there's not going to be a wholesale release of the entire jail population. I think your viewers should be assured of that. But we do need to look case by case and take seriously who could we let out.
The King County Prosecutor's Office says we will not consider any inmate charged with a violent crime, sexual assault, domestic violence, or gun charges. 45 inmates fit the criteria so far, but each will have a hearing before they're released.